Good morning, everybody. I'm Barbara Derrick, and I'm the Executive Director for Smoke Free SC, and I'm so happy y'all could join us this morning to hear about our Can Quit program. And also, we're going to have a legislative update from Beth Johnson, who is one of our board members, and I'm excited that we have several or a couple of our board members on the call. So Addie Gill is one of our board members, and Lamar Suber is. And if I've missed anybody else, I apologize. That's all I can see on my screen.
Tammy Timms is here.
And Tammy is here.
Yeah.
That's great. We're so glad to have y'all on board. So I'm going to turn the meeting over to Tara Bell, and she'll do the introductions of our speakers. Thank you.
Hey everyone, thanks for joining us this Friday morning. 3 minutes before the meeting, my laptop decided to reboot. So I hope that's maybe not an omen to the rest of the day. But we are thankful that you're able to join us this morning to hear about our Can Quit initiative and to hear a short legislative update from Beth Johnson. We're going to start with Beth. I'll let her introduce herself, and after Beth, we'll roll into our Can Quit introduction. As always, these meetings are recorded. We will post them on our website and also post them on our YouTube page if you need to go back and watch something or if you want to share it with anyone else. But I'll hand it over to Beth now.
All right. Good morning. It's good to see you guys. And where's Nancy? I can't see you, Nancy. I heard you, but I can't see you. So good morning. I'm excited to share a little bit about a legislative update, and I'm really excited to share on the call today with Nancy, who is my former director and mentor for like over 15 years. So you guys are in for a treat to hear from Nancy and the work that she's doing. So we have this event happening soon in South Carolina, well, across the country, right? Just a little event we have going on. I wanted to share a legislative update, kind of thinking around elections and all that's coming up. And so in South Carolina, we have all the members of the South Carolina House of Representatives who are up for re-election. Of course, we have the governor's race, we have the superintendent of education, there are a lot of other state agencies, and a lot of local races. So it's crazy right now. You can't go down the street without seeing hundreds of yard signs and commercials all over the place. So it's kind of a fun time for us in our world, for those who really enjoy watching and following policy. What this means for us, this means for tobacco advocates, and I consider all of you guys on this call tobacco advocates. What it means for us is that we have some change coming up in the State House. So last year, at the end of the year, end of session, we had a new speaker who was elected for the House. And last year was also the first year for our new Senate president. So we already had some change starting. And now after the November elections, we're going to see a little bit more of that change. We'll have new committee members. We'll have new chairmen of committees that we follow and watch. And then, of course, we'll have new House members. So I wanted to share just 4 committees that I think are pretty important for our team to really focus on and to be paying attention to. And the House, those 2 committees are House Ways and Means. And these are the folks that do the budget. So it's House Ways and Means Committee. And also in the House, it's House 3M. Oh, there's Nancy. Hi, Nancy. In the House, it's 3M, and 3M is medical, municipal, and military. So those 2 committees in the House are really important for us to pay attention to, and it's going to be interesting to see the shakeup that's going to happen in Ways and Means. In the Senate, 2 committees also to really kind of focus on, and that is Senate Medical Affairs and Senate Finance. Again, the guys that do the budget, right? So those are the 2 committees in the Senate to really kind of pay attention to. In the past 4 years, we have seen the tobacco preemption bill come through these 2 committees, except for 1 year when they tried to push it through judiciary and didn't think we were paying attention. But these are the committees that most often we will see this bill go through, the tobacco preemption bill. So pay attention to those. They're going to have some leadership changes. We do expect tobacco preemption to be reintroduced. 2023 will be the first year of a 2-year session. So all new legislation has to be reintroduced. It'll be interesting to see who the bill sponsors will be this year for tobacco preemption, because the bill sponsor for the past 4 years retired in the House. So we'll have potentially a new bill sponsor in the House. I'm not sure really who that's going to be. I've heard some rumblings, but not 100% sure who that'll be. But the tobacco preemption bill, of course, is the bill that we've been fighting so hard against for, gosh, the past 4 or 5 years. And this bill, it removes local control. So all of our amazing local coalitions on this call, it prevents our local coalitions from working on tobacco ordinances related to retail licensing and flavored products. So 2 really important issues for several of the coalitions that we work with around the state. The tobacco preemption bill is it's interesting in a lot of different ways, and we can talk about the nuances once we know who the bill sponsors are, because we'll make this our #1 priority, and we'll fight against this to make sure you guys in the local communities can keep that control to help regulate your communities. So we're looking at tobacco preemption. I've heard some rumblings that there might be tobacco 21, a T21 bill that will be reintroduced in the Senate and the House. This bill is really, really interesting. It really is an industry bill. Like, tobacco control advocates are not asking legislators to introduce a T21 bill because we already have the federal law of T21. And in South Carolina, our state constitution says that you cannot restrict the age of sale for any product other than alcohol. So in order for South Carolina to change our law, we would have to change the Constitution, which is a process and would take several years to do. So we're not there. And from the American Cancer Society's perspective, we're not focused on T21. We think it's a distraction brought to you by the tobacco industry. So we'll take a look, we'll monitor, we'll do what we have to do if we need to do some damage control. The other bill that might come up this year is the tobacco retail licensing bill. And this bill was introduced the past few years. And it's an interesting take, and we used it really as a tactic to help us with preemption. So, as we were talking with tobacco companies, and they said, well, we don't want a patchwork of laws. We said, fine, give us a state law, like a whole entire state law, tobacco retail licensing. Let's make it uniform across the state. And so that they didn't really like that, of course. That kind of got them up in a little tizzy. And so they tried to, fight back on what they could do. So the tobacco retail licensing bill may be reintroduced. I'm not sure where that stands yet, but we'll see. We'll monitor it, and we'll see if there's opportunities for the coalition partners around the state to engage. So we're looking at 3 major tobacco bills that could be introduced: tobacco preemption, tobacco retail licensing, and tobacco 21, restricting the age of tobacco. And that is not even including all the fun local work that we're working on, which is local smoke-free. So just a shout out to the coalitions that are working on local smoke-free. Phil, I see you in the upstate. That's right. Greer is slowly but surely, right? We're moving slowly, but we're moving. So Greer, we're doing some work in Greer. We're doing some work
Travelers Rest,
and some other little places in the upstate. We're looking at our friends down in Charleston as they do some local coalition work with flavors and tobacco retail licensing. Back up to Rock Hill with Dr. Dave Keeley's group as they work on some tobacco retail licensing as well. So we have these really strong, really good local coalitions around the state that are trying really hard, while they still have the opportunity and the state doesn't restrict them, to work on these local movements. So we're excited and we're really thankful that that is happening. So I think that's my time. I'm losing my voice. Allergies are yuck. And happy to answer any questions that you guys might have, and happy to talk to anyone after the call if your community is interested in engaging in smoke-free, or if your organization would like to talk more about how we can fight against preemption.
Thank you, Beth. And if anyone has any questions they think of later in the presentation, feel free to put them in the chat box, or you can directly message them to Barbara, me, or Beth, anyone you have a question for.
And I have to say, Nancy, it's so good to see you. And when Nancy's face just popped on the screen, I just got really nervous. Nancy is like this
Oh, no.
legend in herself. And so, Nancy, I just got really nervous when I saw you to make sure I'm saying things correctly. So it's so good to see you, and so good to see you guys.
Oh, well, thank you. Great report, Beth. And, we don't do anything quickly in South Carolina. So, if it takes a decade, we'll. I wanted to ask Phil if there's any movement in Greenville County.
So not specifically Greenville County, but our goal is to work within the municipalities within Greenville County. There's several of those. And so once we get those on board and have an ordinance, then we'll go knock on the door for the county and say, you're the only ones left not playing in our sandbox. So.
Okay. All right. Thank you. Well, go ahead and start if that's all right. And I want to thank you all for having me on. We tried this last month, and then we had the hurricane come by, and that didn't work too well. So, but there were a few people on, and to those people that came on, I'm very appreciative of that. So, one thing I do want to begin, and tell me if I'm wrong in saying this, Sharon. One of the great things about the cigarette tax that we got, where we were able to get some funding to do some wonderful programs. And one of them was SC CAN Quit. And the first year of doing it, Galia Walter, or the first group of cohorts, Galia Walter was a big help with that. And then she really decided she wanted to retire. Well, I retired from ACS CAN 5 years ago. It doesn't seem possible, but then I can't leave it. Tobacco is just something that is really gets to me. So I've enjoyed this, and so I appreciate you bearing with us. It doesn't matter what computer I bring. This is why on some of our other calls I've had issues at home. I don't know, but maybe I'll just go get a new one and forget it. But I'm going to just share my slides here and just go from there. And if you have any questions, we'll write them down and we'll hold them for the end so we can get through it, because it may be answered later on in that. But why SC CAN Quit? Smoking and cancer treatment. And continued smoking after cancer diagnosis increases the risk of treatment side effects, secondary cancers, and mortality. This is something that we all know. To address this, the National Comprehensive Cancer Network, NCCN, developed clinical practice guidelines for smoking cessation, encouraging that all cancer patients be screened for tobacco use, screened for or advised to quit, and provided with evidence-based cessation counseling, medication, and follow-up.
And Nancy,
Yeah.
your screen for the slides, I don't think it's advancing. It's not in a slideshow mode. So all we can see is this SC CAN Quit first page.
All right,
Okay.
We're going to work again. Just a second.
It's doing that.
Just select it. Don't let it run automatic. Manually push it.
It wasn't in the slideshow presentation mode. It was just all the slides up. So,
We honestly came over here early to try to get everything all set up, and can't seem to get either one to.
if you want to send it to one of us, we can put it on and then advance it for you.
Mm-hmm.
Do it on yours?
Yeah, I'll do it.
Okay. Well, Miss Katie here today. This was Katie's bailiwick. And so, all right. So I want to talk just a minute about Dr. Graham Warren. How lucky were we in South Carolina to get Dr. Warren down to MUSC, along with Dr. Cummings and a lot of good people down there. But I'm going to try to see if we can get this to, I apologize, folks. Oh, no, I went too far. Just a second. We'll get it here.
He is a radiation oncologist at MUSC, and he knows just about anything, all things cancer. And we've, as I said, very lucky to have him there. And he has done things to mention how tobacco use impacts treatment incomes. And Dr. Warren is a pioneer of this type of research. And let me try to see if we can get going here. Particularly smoking during cancer treatment, leading to poorer outcomes and a greater chance for the development of secondary cancers. And as a result of his work, they began integrating a full-scale cessation program into Hollings Cancer Center. And he encouraged, he encouraged state tobacco partners to begin working to address the issue, resulting in the SC CAN Quit initiative. And probably a lot of you on the call today know that, and you just yeah. So around let's see, that was around 2015, he was engaged with the National Comprehensive Network and encouraged them to introduce clinical guidelines for treating tobacco use in cancer patients. Now, these guidelines were integrated with into the SC CAN Quit initiative, including screening for tobacco use, advising to quit, and engaging the patients in quitting services. That's okay. Right.
The presentation just came through on my end. So do y'all want me to share it?
Yes, yes, that would be fine.
Okay, let me get it. Hold on, I'll be right back.
And this presentation is all on there. So this should hopefully help folks if it's pretty much up to date and help with a lot of the work that you're doing. Okay, before this initiative, very few cancer centers provide comprehensive tobacco cessation services for their patients for a number of reasons. One is the cost of the program development and implementation. And then clinicians may shy away from encouraging cancer patients to quit smoking. And then the NCCN guidelines are only voluntary, which I found was, yeah, that just, okay.
Yeah, I don't mind.
Okay, can y'all see my screen?
Okay, got it.
Okay, awesome. Nancy, just tell me whenever you want me to, you know, shoot
Okay.
ahead. I think I'm where you are, but just let me know.
Go two more. Go.
Okay.
Okay, right there. Where we go. So this is truly a partnership for action, as in all the work that we do in tobacco control in South Carolina. We are a small state and a few workers at first, but we have grown to, I think, pretty mighty army in the state. And the guidelines of cancer, to promote the new treatment guidelines, a partnership that was created between the state cancer control partners to pilot a project to assist cancer centers to adopt the NCCN treatment guidelines. So South Carolina set out to launch the SC CAN Quit initiative, and that was an effort to integrate tobacco cessation as a standard of care across the state. Okay, next one. And here's, you'll see the partners, and I want to take time to read those because you can, it's very important. Of course, the State Department of Health and Environmental Control, the Medical University of South Carolina Hollings Cancer Center, the University of South Carolina, and then grants from CVS Pharmacies, Telask Technologies, which is data evaluation and follow-up platform, Alere, Optum, which is our SC Quitline vendor, Smoke Free SC, and SC Cancer Centers. Within that Smoke Free SC are all of our partners from our voluntary health organizations, and just good folks all around trying to help us to do this. Okay, next one. Okay, a grant announcement was distributed to all state cancer centers. Now, I think we thought that everybody would be really excited to get these. And the first round of grantees were 3 cancer centers, and they were Carolina Blood and Cancer Center up in the Rock Hill, Cancer Care Associates, that was up in the Rock Hill area, and then AdMed in Anderson, and then Mabry Cancer Center at the Regional Medical Center in Orangeburg. And this was a little bit of an effort. And then once this was out and accepted, we have our first round of grantees. Okay. Ready for the next one? Okay, our intervention strategy consisted of 3 collaborative sessions, monthly quality improvement calls, and then structured technical assistance from the fields of cancer control, tobacco control, and with partners from TELAS Technologies. And let's see. Okay. All right. So one of the really important partners in this is TELAS Technologies. And I'm very pleased to have on the phone today. I don't know how many are on from TELAS, but I've asked Peter to share exactly what TELAS does in a nutshell, because if we don't have any information of what we're doing and keeping track of numbers, there's no way we can continue this program. And TELAS is remarkable in doing this. And so you'll should see the results. Is that's up next?
Yeah, let's see if Peter wants to say.
Oh yeah, then Peter, I want Peter to give his thoughts now.
Good morning, everyone. I hope you can see me there. It's a pleasure to be able to address you this morning. So I wanted to tell you a little bit about TELAS. TELAS's a healthcare company, and we're focused on chronic disease management and population health. We have a software as a service, we call it Quit Manager, that has been designed specifically to support tobacco cessation in hospitals and clinics. As everyone knows, tobacco use is a chronic relapsing condition, and it often takes many attempts for a person to successfully quit. Most tobacco users are considering making an attempt, but only a fraction is ready to do so at any given time. So the concept behind TELAS is to use technologies to, and that's automated voice calls and emails and text messaging, to reach out to tobacco users multiple times over an extended period of time to offer them help. And in this case, an immediate transfer to the South Carolina quit line. Numerous published randomized trials, many conducted at MUSC in Charleston, have shown this approach works, and that given multiple offers of assistance at different times leads to more successful quit attempts. So how does TELAS fit into SC CAN Quit? Well, first, an integration is done to facilitate the transfer of personal health information of all tobacco users seen each day from the electronic medical record of the cancer center to TELAS servers. Once that feed is live, TELAS begins an automated follow-up of each patient for up to 6 months. To manage this process, TELAS assigns a dedicated resource. Aaron Greenwell, who many of you have already met, is that person in South Carolina. Aaron hosts weekly meetings with the IT departments at the cancer centers to help complete the integration, and it's a very complex process that sometimes takes months. She's there to explain the system, to train personnel at the cancer center on how to use it, and to manage the delivery of monthly reports. I have to say that we're really gratified to see the results. We've managed to exponentially increase the number of smokers who are taking the call to action and being referred to the quit line, and we're seeing many more quits as a result of the service. And that's pretty well it, Nancy, in a nutshell.
Do any of you have any questions? Oh, if you have any questions of Peter, or we'll go ahead and just talk a little bit more about this. At the end of this first project, over 1,500 cancer patients were screened for tobacco use, with 283 of them being identified as current smokers. And let's see, we're still working. And of those, 207 were advised to quit, and 181 were referred for tobacco cessation services. And I want to take a little liberty here, and those of you that know me know I really like the saying of the power of one. And that may not sound like a lot of people, but to the loved one of that one, or the things that are going on with this, we're saving one life at a time. And hopefully soon we'll have this integrated throughout the state. I will say that MUSC has done a great job of doing that, and we're grateful for all the work that they put in. Okay, next one. Okay, so the findings were presented SC CAN quit in a number of different events. And the first, we had a South Carolina Cancer Alliance Evidence Academy. And that was an exciting event to be a part of. Then the National Conference on Tobacco or Health, SC CAN quit, was had a place at that. And then the Surgeon General's Interagency Committee on Smoking and Health, that was published in 2017 also. And then the published as a manuscript in the Journal of Smoking Cessation. So I feel like for a small state, we've really gotten some great recognition throughout the country, probably throughout the world. Okay. And now phase 2 was the group we took recommendations from the first grantee group to make program enhancements to SC CAN quit. It was a learning process, and it continues to be a learning process for us all. And so the second group was funded, and that consisted of what was Greenville Hospital Systems, but it CIOS, but this is now part of the Prisma Upstate, and Prisma taking over a lot of the hospitals as well, and then the Gibbs Cancer Center at Spartanburg Regional. Both sites engaged in electronic health record enhancements for direct patient referral to the South Carolina Tobacco Quit Line. One site has integrated Tell-Ask Quit Manager program into the EHR to support patient monitoring and data collection throughout the process. This site is also linking their lung cancer screening patients into evidence-based referral processes to automate the linkage to cessation service. Now, both of these took a little while getting going, but it was a very exciting time for us. Two hospitals that are two hospitals that were not really close, and as far as they were competition to each other. And but at the end of this, one of the takeaways were that both hospital personnel said they were grateful for this program so that they could continue to share information, and that's has been going on, and so we're excited about that, and really pleased with how Gibbs Cancer Center has done, and Chad's been wonderful up there. Okay, and then the results from phase 2. Okay, results from phase 2. As a result of the automation in these sites, their capabilities were over 41,000 new cancer patients across the two centers were screened for tobacco use. I mean, 41,000 new cancer patients. 5,730 were screened for tobacco use were current smokers. And then 12% or 705 of the 5,730 tobacco users were advised to quit smoking. 83%, 586 of those screened, 705 were referred to tobacco cessation services. And then as a result of the automation in these sites, the patient numbers grew tremendously. And let's see, right here. Oh, sorry, our screen keeps jumping a little bit here. Just one sec. Goodness. Okay. Of those 705 were advised to quit, and the 586 that we talked about it became embedded in their program now. And so they're doing a great job there with the cancer centers at Gibbs and CIOS. Okay. Then we had phase 3, and that's when COVID came along and upset our world, and felt like it, I don't know, it seems like it's taken its toll on a lot. It was a hard time. We had a hard time getting this phase 3 COVID or phase 3 session off because of COVID. Things were different, and you know, it was just we had a hard time getting out because we couldn't go visit the hospitals and cancer centers, and so we needed to be there in person, we felt like, and so we had a little lapse there. But we do have a third grantee cohort has been awarded, and this includes South Carolina Oncology Associates. Those in South Carolina, we refer to that as SCOA. And then the Aiken Regional Medical Center's Cancer Care of Institute of, excuse me, I did that wrong. Aiken Regional Medical Center Cancer Care Institute of Carolina. And then the results from phase 3, this is what's been going on with them. The first learning session has been completed, and we did have that live. And then our one grantee has just launched the e-referral and is now beginning to utilize the TELASK Quit Manager system. And we're very, very excited about that. One grantee is working through the IT issues to get a referral started. And that's always a big step for us, is this, it just doesn't happen overnight. And sometimes it takes months to get the IT issues taken care of with contracts and everything that goes along with that. And so thus far, hundreds of patients have been identified as tobacco users and referred to the quitting services. So this is one that we're still working on, and this is exciting to us. And now let's go on to the MUSC expansion. As talked about earlier, they have expanded their tobacco dependence treatment service across their newly acquired facilities. And they have automatic referral and follow-up as well. And bedside counseling for inpatient services. These sites include Charleston, Chester, Marion, Lancaster, Florence, and Columbia. So these could have been sites at one time, but with the expansion, they're far ahead of us. And like I said, our goal is to get every cancer center to learn about SC CAN Quit. And they published a manuscript showing the healthcare cost savings for smokers who received treatment services and those who did not. And they demonstrated that cessation programs can be affordably implemented and yield a substantial healthcare cost savings. So that sounds like Dr. Mike Cummings, it is. So, okay. Is there any questions that we might can answer on any of these? And that's kind of a quick rundown. You have the slides, and we can always help you if you can know anybody that wants to have more further information on that. We have a great group of partners. We appreciate all of our South Carolina partners that have helped to spread the word about this. And this has all been very good. So any
Sorry, Nancy, I was just gonna say, we had a question pop up in the chat
Okay.
from William Robinson asking if the information can be broken down into demographics such as race, age, or gender.
That's what we're working on right now. It's happening with this phase 3. That was something that was the race part was not a part of the first 2. But since we had our wonderful cancer, cancer and mortality in African American men, we decided that this is something that had to happen. And we've also worked with wonderful Pastor Paul Birch in the Aiken area, who is very excited to see this happen, because we definitely know that smoking relates to the cancers, and the African American men seem to share that with that menthol, and there are other all the cancers, but if we can get them to quit smoking, and that we have race as one of those demographics that we can take with us, then we'll be able to prove that this can be throughout all hospitals. So did that help, Bill?
Yes, somewhat.
Hey, Nancy, do you mind if I jump in? This is Erin.
Okay, sure.
Sorry, I raised my hand, but I know you're using different monitors, so I apologize for interrupting. And it's really early in the morning where I am, so nobody wants to see me. So yeah, just to answer that question, the organizations that are currently kind of crossing over 2 separate initiatives. So there is, of course, the SC CAN Quit, and there's also a project, the e-referral hub. And so talking about some of the organizations that Nancy was just talking about, Gibbs, and there's another organization, SCOA. And to be honest, I just stepped away for a second, so I'm not sure if SCOA was mentioned. But we do provide, TELASC does provide monthly reporting for those organizations. And through that, the information is broken down into all of those demographic types. And so it is something that all of the information that comes into Quit Manager, of course, is housed in Quit Manager and can be sliced and diced in any way that the organization would like to see it. So definitely something that is kept and is able to be presented back.
Thank you.
Right. And I'm going to just say that I served with Mike Cummings on Louisiana Scientific Advisory Committee for their tobacco control program for over a decade. And it's one of the initiatives that we focused on was, especially as was just mentioned, the impact on the role of menthol in the African-American population, and especially given that Black men smoke more than any other segment of the population. So it's one of the things that I remember when I was involved with tobacco control like 30 years ago here in South Carolina, that we tried to focus on and engaging community-based organizations, newspapers. We had all kinds of people involved, and I just wanted to make sure that we're capturing that information as we're moving forward.
And I think that's a great point. We also, as TELASC, provide a data extract. And so we are trying to make sure that we are collecting all of that granular information from the organization. So I don't think everybody's on this call, but definitely folks who I've provided the extracts to have said that there is really wealthy information, and they're thankful for it. So I hear you that we're trying to look at those specific target populations.
Okay, thank you.
And this is Sharon Biggers, and Bill, it's great to see you on today. That's wonderful. I'll throw out too that as we were developing the phase 3, we used the 20-year cancer report to identify the hotspots in the state where lung cancer among African-American men was highest. And that's why we actually chose the sites that we selected this time. It was showing a number of sites that MUSC was already had efforts going on, but it also showed that the Allendale area, right there around Aiken, the Allendale and Edgefield area had high rates of lung cancer among African-American men, according to the report. So that's one of the main reasons we selected Aiken, because the Cancer Alliance gave us information that that's where they would receive their cancer care. And in addition, with SCOA, we noticed in the cancer report that Lee County and Kershaw County were also very high rates of lung cancer among African-American men. And the Cancer Alliance led us to SCOA as one of the sites where those folks would likely seek their cancer care. So we are really trying to infuse a health equity lens in the phase 3 part of our CAN Quit. Also following in the recommendations of that report, we know that there are issues with care delivery for African-American men with cancer. And so we are also following those recommendations to hopefully have in our second learning session some cultural awareness and cultural awareness training for the providers, so that they are more in tune to the issues and ways that African-American men would like to receive the information about their cancer care and also about their tobacco use. So we are definitely trying to infuse more of a health equity lens in this phase of CAN Quit. And certainly the wonderful rich data that we're receiving now from TELASK is enabling us to do that. So we are trying to be very mindful about that within this particular phase of the project.
Well, you know me, if I can help in any way, let me know. And I'm actually back in the state of South Carolina, been back for a while, and located in Kershaw County. So anything I could do to help, just let me know.
Yeah, we'll definitely give you a call, set up a meeting to talk. And I can't believe it's been 30 years. I've been in South Carolina 23, and you were one of the first tobacco control advocates I met.
Right.
But yeah, it takes us a little bit, but we're finally getting there. And also, as I mentioned, Reverend Paul Birch visits several of the African-American congregations in these rural areas, and he is letting people know of what's going on and how they can get help. And so and I think Dolores Scott with Hold Out the Lifeline is doing stuff as well. And so we hope to keep working on that, because we realize that we have a real problem in South Carolina.
Yes.
So, okay.
That'll do it. Willing to help.
Okay, thank you. Anybody else?
Thank you, Nancy. It was a great presentation. And Aaron and all the other people who joined in, thank you for speaking. We enjoyed it. I did want to talk a few seconds about some updates to our website. So we've been making a lot of changes. As Tara mentioned, we also have videos of the previous tobacco roundtables out there on our website. We've updated some information about our board members, resources, that sort of thing. So I'd love for y'all to check it out. And since we have a few minutes left in our roundtable today, and we have a lot of new people, I'd love for some of y'all to introduce yourselves and talk about what you're doing in tobacco prevention and control in your communities. So feel free to jump in, everybody, and say hello. Anyone? Don't make me call people's names.
Good morning. I don't mind jumping in. I'm Tanya Chang. I'm the Vice President of Government Relations and Advocacy for the American Heart Association in the Southeast region. And I'm covering South Carolina for AHA until we can get a new government relations director.
I know you're going to call on me, Barbara. I just have that feeling. Phil Clark in Greenville at Just Say Something. And forgive me, my eyes are droopy. We just had a fundraiser last night. And so we had our annual auction last night. So we're all dragging a little slowly this morning, but grateful to be able to be here and really appreciate the support that we have in our work here in Greenville County in the upstate from Barbara and from Beth and everybody that is so supportive. We are moving forward slowly but surely with Greer. We've had some recent action in Travelers Rest that we're looking to move forward with that. Probably will happen before Greer will happen, so we'll keep everyone posted on that. And we are continuing to use our airpreserve.org for education. And we have just received this week a sign up for volunteers or people who want to get involved in more tobacco prevention efforts in our community. We received that from Beth and her team. And so we're looking at strategic marketing for that particular piece in Greer and Travelers Rest, so we can build a more of a groundswell in our community so they can reach out to the elected officials to get them on board. We're seeing some changes in our city councils across Greenville County and the in the municipalities. And so as some of the as a mayor said, some of the old guard are finally deciding not to run, and we have a new guard, and the new guard is more open to these type of activities and ordinances for their community. So we look forward to continuing working in that with all of our great partners here on the phone, on the call.
We're definitely excited about all the work that's going on in Greenville County. Jackie, can you come up and introduce yourself, our Counter Tools partner?
Hello, everyone. Yes, my name is Jackie Boards. I'm from Counter Tools. I'm the project director at Counter Tools for South Carolina. So I work directly with Barbara and folks like Phil and you all on the line to do the point of sale work. So we are on the kind of point of sale side and working with the local areas on tobacco retailer licensing and all of the flavor related stuff and all of that point of sale stuff. So yeah, that is me. Anything else you want me to say, Barbara?
No, that's it. And
Okay.
I did want to say that was one of the updates to our website is that we did assessments of the point of sale of activity in all counties except for Florence, which we're going to try and tackle next year. But the information from those assessments is on our website, along with county profiles on smoke-free policies that were done. That work was done by DHEC. So those links are out there on the website with a PDF for each county, if y'all want to know about what's happening in those areas in your work, in your counties, in your localities. And then Lamar, I'm going to put you on the spot. Lamar is one of our newest board members. So hopefully, hey, Lamar.
Hey, how are you? Good morning, everyone. My name is Lamar Suber. I am the program manager of co-occurring programs. It's a joint position between the South Carolina Department of Mental Health and South Carolina Department of Alcohol and Other Drug Abuse Services. And within the tobacco world, I'm actually leading the trail in the behavioral health field for the state in terms of our policies and procedure changes that we are trying to make and instill for our employees and our patients across both DMH and DAODIS. I'm also helping to have different people in our system trained to become tobacco treatment specialists, and just trying to link as many people as I can to all of the work that's being done, not only at Smoke Free SC, but then within local communities as well.
Thank you, Lamar.
No problem.
And Addie, I'm gonna put you on next, Addie Gill. Addie Gill's our newest treasurer, our new treasurer. I shouldn't say our newest treasurer. Our new treasurer for Smoke Free SC.
Good morning, everyone. It's a pleasure to be part of this. I have a lot to learn, and this has been a most informative meeting, so thank you very much.
Thanks, Addie. And then Mackenzie, it's good to meet you. Mackenzie Henry in the chat put down that she is a prevention specialist at Counseling Service of Lancaster. So it's good to meet with you. And if there's anything we can do to help you and with your kids in Vape Talk, we'd be happy to do it. We are getting ready to roll out a Vape Talk program for students. We currently have one for parents, and Tara, I'll let you talk about those programs.
So thanks. So like Barbara said, the Vape Talk that we have been implementing in the past is mainly for parents and for caregivers of youth or providers of youth. We have had, youth attend some of these meetings, but the audience that presentation was designed for were adults. But we have had a ton of requests for Vape Talks, like short Vape Talks that can be given to youth. We know that there are more in-depth self-led programs out there. And we always recommend those as follow-up educational resources. But the one that we are currently adapting is meant to be short, 30 minutes, maybe 45 with questions at the end. It's a good introduction. We focus on the health risks of vapes and how youth can be impacted by those health risks. We are using the Stanford Tobacco Toolkit as a resource, as well as just, merging with some of the information that we had in our adult focused Vape Talk. Those adaptations will be finished soon, and we hope to start, using that across the state if people need just a short vaping introduction to youth. We will post updates about that on our website and on our listserv and Constant Contact when those adaptations are finished. But we look forward to being able to serve an even more diverse audience with that presentation.
So Mackenzie, if you need our help, please reach out.
Okay, thank you.
Sure. All right. Anyone else who'd like to introduce themselves or tell us what's going on in your area? I guess. Yes, ma'am.
I just wanted to take a minute and say we're very grateful that you are our leader now. And Barbara is a wonderful lady and so knowledgeable in so many things. And we're just excited that you'll be assisting us and let us assist you.
Thank you, Nancy. I appreciate that. I'm excited that I am the new executive director and can't wait to work with all of y'all. Our next tobacco roundtable was scheduled for the 4th Thursday in November, but as you all know, that's Thanksgiving. So I don't think we would have much of an audience, but so we are going to reschedule that to the 18th of November. We're working on a speaker now and we should get that out next week. So just look forward to that and register for the 18th of November. We will not have a roundtable in December because I know I'm not gonna be able to get here. Anybody here on Christmas Eve or or New Year's. So we'll give you that month off. But next month we'll be sending out the announcement on who the speaker is in next week. Okay. Well, if there's nothing else, we just want to thank you all for being here today. Thank Nancy, our great speaker, Beth, for giving us a legislative update, and we will see you next month.
Thank you.
Thank you.
Thank you.
Thanks, everyone.